Hi, I'm Lauren and I am the Smile Advisor here at Dentistry on the Clyde. Today I'm with Ross, one of our pain-free dentists, and we're going to be talking about the most frequently asked questions that I have in smile consultations when it comes to Invisalign. First question, what is Invisalign?
So Invisalign is a series of clear aligners that you clip in and out, you wear them all day, and it helps to straighten your smile and improve the appearance of your teeth.
Great. How do patients know if they're suitable for Invisalign?
So everyone's different, and patients will know if they're suitable by coming in for an assessment. We can have a simple look at your teeth, do all the appropriate checks to make sure things are healthy, but assuming everything's healthy, then pretty much most people are invisible for some form of Invisalign treatment.
Perfect. What is the treatment process and how does it work?
So the process is, patient would phone in, they would come in and see yourself, they would have a consultation about what Invisalign is, you would show them it, show them some befores and afters, some videos, and chat through pricing and costings, and then they would come in and see one of the dentists. From there we would do all the checks, make sure things are good to go. We can use our 3D scanner, so instead of impressions now, we scan the teeth and we can show you within a minute before and after of how your smile will look. Which is just incredible for you to be able to see and see that journey from day one. And then if everything's suitable, we send that off. We plan on your smile, kind of customise it depending on what you want to do with your teeth, which is again one of the major advantages of Invisalign, and then we just start the process.
Great. Can patients eat and drink while they're wearing the aligners?
They can. It's one of the best parts about Invisalign, so unlike traditional braces where you are restricted from quite a lot of foods, Invisalign has that advantage that you just simply pop them out, you have whatever you want to eat and drink, ideally with a quick brush, pop them back in, and good to go.
Could patients expect to have any pain or discomfort when they're going through the process?
Quite simply, no, it's not painful. I know that I've done Invisalign myself, and the feeling is quite simply one of tightness. It feels just like a little bit of mild pressure on your teeth, which every time you put in a new aligner, that tends to last for 24-48 hours, and then after that it settles down. The more aligners you go through, the more you go to quite enjoy that feeling of tightness when you put it in, because it feels like it's working and your teeth are moving and you just know things are going the right way. But it's definitely not painful.
Great. How long does it usually take to have Invisalign treatment?
So it varies from patient to patient and case to case. It's very different depending on what specific position your teeth start in and where you want them to finish, so how much movement there is to do. I've seen it take as little as 4 weeks for a very, very mild case, and treatments can take quite a long time to move your teeth properly in certain cases, but it depends on if it's crowding, spacing, deeper bites, but we would assess that on the day. We could give you a rough idea of how long it would take, and then once we send that off and get the proper checks to show you, we can tell you exactly how long that would take after coming in.
Great. Will patients' teeth move back to where they originally started from after the treatment?
So they can. One of the things with moving teeth is that they can always move back, which is why the most important part of any orthodontic treatment is the retainers after. So retainers come in two forms. You can put a fixed one, which is a wire at the back of your teeth, or a removable one, which is essentially like a clear aligner, very similar to the Invisalign treatment itself. We at Dentistry and Clyde get both of these, and that's included in the price of your treatment, and it's not a hidden cost at the end, it's all up front, but we make sure you get both. And with Invisalign, one of the great things is that you're so used to wearing a liner, you actually kind of miss it after, so wearing the retainer after is brilliant, and I hate not wearing the retainer.
Perfect. And the last question is, what are we talking about when it comes to price?
So again, price varies on case to case, and it very much depends on what we need to do with your teeth to get them where you want to be. Invisalign has different packages, and we only really know what's suitable for each person once we can get you into a situ. So it's similar to if you have somebody to paint a room in your house, they need to see the room in order to let you know how much it will be. But phone in, free consultation with Lauren, can chat you through the basics of it, and then you come in and see one of the dentists and we can give you a better idea from there once we know what we need to do with your teeth.
Perfect. Thank you so much, Ross. If you would like to know if you're suitable for Invisalign, or you would just like to come along just to have a look over some of the pricing, do just give the practice a call. Thank you.
Thank you.